to solutions, and what are some of the solutions that you all recommend for some of these barriers? And as physicians, a lot of that is going to be out of your purview, but I'd love for each of you to suggest any solutions for our patients and care partners who may be facing some of these barriers. So this time we'll start with you, Dr. Nyame.
This is an area where I think we need to do better in collecting information to understand where the need is. And so I think there's a very much a need for translational health services or patient-centered research where we do the simple thing. If I was going to open up a lemonade stand in the middle of Seattle, I'd probably ask a few people what their needs are around lemonade before I open the stand. And I think in medicine, we often offer services and solutions without having had that simple conversation of what are the needs. I think in addition to that, we have to understand that equitable care might mean offering additional services for certain populations. So for us at our cancer center, for instance, we've recently instituted a patient navigator program, something that's been around for a long time at other sites, but it's allowing us to do that, go through that exercise of providing some equitable care by helping people coordinate appointments, find their way to financial resources that might support them, and just to be there as a support in the very difficult time of having a new cancer diagnosis. So I think that's a well-proven and well-established method for helping people get good access to care. The other thing I'll add is that we make decisions. I think as humans, we make decisions through community, and sometimes that's our partner, sometimes that's the buddy at the gym, sometimes that's a coworker. And there are a lot of really fantastic patient advocacy networks that exist that can help people find this new community. And I think cancer patients share a very unique bond and a very unique way to communicate with one another because they're living through this particular diagnosis. And so in the case of prostate cancer, especially prostate cancer in Black men, you have the Prostate Health Education Network. You have Zero Cancer, you have Us Too, you have the Prostate Cancer Foundation. I'm probably leaving some advocacy groups off, and I'm probably going to get in trouble. But I think that there's that opportunity to reach out to others and just learn. What did you go through? What worked for you? How can I meet my goals of care through just conversation with other patients and survivors? And I'll try to leave something for Dr. Grivas to add to the conversation, because clearly I could go on and on about this.
Dr. Grivas?
I can tell you that I'm learning every day from Dr. Nyame and his fantastic work in this important topic. And I think he covered the answer so well. If I can just add a few more things just to expand on his thoughts, and these are things that already he's doing in his programmatic development in our institution as well. I think, one of the important things we have to acknowledge, all of us, is, the issue of systemic racism and implicit bias that I think you referred to, Dr. Rochester, which I think the more we talk about it, the more transparent we are with it, the better, right? Because we can think about what are unconscious or subconscious, thoughts that we may have, oh, this patient doesn't care about themselves, why should we go the extra mile to help them? And the answer is we should go the extra mile to help them, because this patient, may have, less insight in the situation, and they need more resources. And as a healthcare system, we should try to earn that patient, right? We should not let that patient go, because every patient matters, right? And I think every life matters. I think that's important, I think overall, systemic issue to discuss. The other thing is, getting ourselves to the community. And I think there are examples of studies we have done in the Cleveland Clinic and other areas that we try, to utilize the wisdom and the help of local leaders in those communities, right? For example, underserved population, go to local churches or barbershops or gyms, as Dr. Nyame mentioned, and collaborate, work with the local leaders and see how we can have a dialogue with the patients there. How can we establish this trust that may be missing? How we can convey that health is important and prevention is important and treatment is important. How can we help with the financial concerns, right? How can we get patients to the cancer center without them having to worry about how to get there? How can we reach out and have screening in the prostate cancer screening in the community if it's indicated? Then access to care through telemedicine, and that brings an issue. Do the patients have equipment for telemedicine, a computer, internet access, right? We take it for granted, but it may not be. So giving them those resources, organizing some local centers. We did this men's health day in Cleveland Clinic just to get people in a room and educate them about but also learning from them what are the barriers to take into account. Not talk down to them, but learning with them and from them. The other thing is research, and we'll have to do a better job to include and offer in an equitable manner clinical trials to our patients, including patients from different races. And we are doing, I think, overall okay, but we're not doing enough. We have to do better in order to provide these opportunities to our patients. And the role of patient navigator is great. We can set examples that we have with Dr. Nyame of patients who feel much more comfortable when they have a patient navigator. Sometimes, if it happens to be on the same race with the patient feels more comfortable. They have someone that they can trust or be easier to talk to. And I think we should definitely improve our hard and work harder to provide access to research in an equitable manner to all patients. The last point I would say is patient copay assistance programs and foundations. I think we can definitely include, more resources to our patients, philanthropy, foundation support, and state programs in order to, give those patients the resources they need, again, to achieve this holy grail, which is equitable healthcare.